Welcome back, everybody, to the
Mhm.
monthly Holistic Actions Q&As, where we'll walk along this path to pet wellness that's paved by energy, love, and always doing the right thing because we've got a roadmap that's going to tell us what the right thing is to
And
always do for our pets.
Megan
And
Kelly
if
had
you
a chance
see
to
the
interview on
React,
the video, and she
um,
brought up
I'm
specifically
going
a
to
whole
just mute
food
everybody. Yep,
bowl
I'm just going to
purchase
mute
idea,
everybody,
and where
and
that
you
sits.
can unmute yourself, Dr. Christina. So we've got the React button at the bottom, so you can either raise your digital hand or type in the chat. Right, and
I'm
now how do I
muted.
lower
There we
it?
go.
There we go. All right.
Had to unmute myself. So I'll start with Melissa's questions. And you shouldn't need annual rabies vaccination, and you need no other vaccines at all. But rabies, legally, you need to have. So it depends on where you live, what the law is. But generally, in most places in the US, rabies is every 3 years. And we have much on the forum, much on the website, in the vaccine. If you go to resource library, ways to possibly help with any negative reactions to any vaccine you have to give. And again, I know you guys all get tired of this who know it, but we always have new people. Be sure you have a holistic vet now. Don't wait until your animals are sick. Don't wait until you need a rabies vaccine and you wish you had a holistic vet to maybe get an exemption. Now is the time to have a holistic vet on hand and be working with them.
And I just want to quickly mention the best strategy for any vaccine or any stress is have your pets' best balance before you expose them to the vaccine or any stress. And as Dr. Christina said, if you have a vet homeopath or an energetically related vet on your team, they're going to help you do that before and after.
And it's up to you as well, because the legally required is usually every 3 years. Here comes your 3 years. And you're like, I don't want to do it. I don't want to do it. I'm going to wait until the last minute. I'm going to wait till the last minute. No, this is a time to think differently. About 3 months before your vaccine is due, start paying attention to health. And you want to, whether you give it a month before it's due or 2 months before it's due or a month after it's due, you want to have your animal in the best possible shape. If you're dealing with some chronic illness, like some itching or some ears, it may be that you can't completely resolve it before the vaccine. So as you're doing the ups and downs of how they're feeling beam wise, how the ears are doing, you want to you want to go ahead and get that rabies vaccine when the health is the best. And then spend the rest of your 3 years before the next one building up health. And for everybody, including Debbie, there are homeopathic veterinarians who will work by phone. Post in the forum, check in the forum. We've been doing that all the time. And we have multiple discussions about that. But we do have homeopathic veterinarians who will work by phone. So that will help you in Bermuda. And we need to get now, I actually thought I had a holistic vet in Bermuda. But it's been about 15 years ago. So check it out. Really call every single veterinarian who's in Bermuda and see how they are. Don't ask if they're holistic.
Yeah.
But if you live in Bermuda, that's a pretty small place, bigger than we may think, but still talk to the veterinarians in person. See if you can catch them at the grocery store. See if you could get in conversation with them. Are they thinking? Are they willing to be working with you? Or do they seem to be you have to do it this way? But
And
definitely you can do virtually.
For sure. And Debbie in Bermuda, Janet Anthony does seem to be pretty open-minded. She's supportive of the people that I work with in Bermuda.
She's in Bermuda?
Yeah.
Oh, cool. Would you
And
post?
sure.
uh,
Let me see if I
Definitely
can get a
pop her
link.
in there. Let's see. Kier, bad breath. So bad breath is one of the early warning signs that there's an internal imbalance. Sometimes you may want to explore different diets. You may want to look at doing a test for the microbiome of the gut. You may want to just do a fecal transplant, because often the bad breath can be reflecting that. Go to your holistic vet. And if you have a young dog, you definitely need to have one who's at least within a 5-hour drive that you can go to when you need a really holistic exam. Have a local one for emergencies or just there at the emergency room. But if you have a veterinarian who can do a TCVM pulse and tongue diagnosis, one who can do a chiropractic, balancing, all of these can help diagnose what the internal imbalance is that's causing it, or work with a remote
Good question.
Good question.
homeopathic
I haven't
veterinarian.
read it yet, did you?
The best diet, Debbie, for any animal is the one that they seem to be doing the best on. We don't really use specific diets for specific conditions. So fresh food from a local source with a lot of variety. Raw meat, pureed vegetables, cooked and raw, lightly cooked meats, crock pot meals, all of those are fine. The key is when you have a dog with IMHA, you definitely need to be working with so if you want to unmute yourself, do you have a homeopathic veterinarian or a TCVM veterinarian you're working with?
Hi, it's actually, I have a little store here, dog store. So it's a customer that just came in today. And we really, I do go to the veterinary clinic that you spoke of, but they're still a bit like very traditional in their approach. I sell Dr. Harvey's food, for example, here, and that raised a whole bunch of uproar. So it's like they're still very kibble oriented
Right.
here. So I was just trying to provide any insight to the customer because the dog was just diagnosed and they were going straight to steroids, I believe.
Well, and again, it's a conversation you can have. And the most important thing is you can send them to the 101 course, which is free.
Okay. Okay. Thank you. I'm learning all about your site. So thank you.
Once you've taken the 101 course, and also the fact that as for free, you can search the forum. So you can have them actually go to the forum and search. And because you run a store and may be doing this a lot, drop an email to us and you can become an affiliate.
Okay.
So
great.
when people become members, you get part of the membership. So you want to check in to make sure you're checking on what we have available.
I want to educate myself as much as possible. So I'll look in to see what learning resources you have available.
There is so much on there. I mean, really, if you would commit, if you'd committed 5 hours a week to studying what Holistic Actions has available, you could spend about 2 years learning everything that we have.
Fabulous.
That's how much material is there. So keep it up.
Thank you.
Thank you.
Thank you. Thanks for your time.
Where are you based, Debbie?
We're right in the middle of it's in Paget in Bermuda. So we're right.
Oh, you're the one in Bermuda. Oh,
I'm the one in Bermuda.
Okay.
Yeah. So limited resources. Thank you.
So you're the key thing for everybody there. That's awesome. What's your store's name?
It's called Boats and Barks. There are I just deal with dogs only. There are some other very large big box pet stores, but I
Great.
try and do all natural. So
Excellent. Well, keep working on it. Do courses.
thank you.
If you
Okay.
get enough people together to pay to fly me out to Bermuda, I'll come do a week worth of courses, of different courses.
Oh.
I can do like 3 evenings in a row and then do a long weekend
Oh,
course,
wow.
whatever.
Okay. I will look into that. Thank you.
You're welcome. Okay. 14-year-old cat with hyperthyroid. So here's the thing. There is no one right answer, Ellen. You may want to, unmute yourself. And the thing, so over the years of 40 years of being a homeopathic veterinarian, I have treated many hyperthyroid cats with homeopathy. And their quality of life has been great. I would say 80% of them did fine and lived another, lived out a full lifespan. However, there was 2 or 3 that didn't do well. And they went ahead and had the radiation, and they bounced back, did great, had a great quality of life for a year, and then died. So my experience with the radiation and the surgeries has been that a few do okay with it, but what conventional medicine considers a success is fairly short term. And then I do know of some that have been reported that live a long life. So it really is I would do at least one consult with a homeopathic or a traditional Chinese medicine veterinarian to help evaluate what are the current symptoms, how miserable, happy, good beam, bad beam is your cat at this point. Sometimes the hyperthyroid is diagnosed, but the cats feel fine. And then you would definitely want to go with starting with homeopathy, which again can be done virtually, or good TCVM if you're local, along with everything we talk about. Fresh food diet, lots of love, you all learning energy healing techniques like Webb, Bingston, Reiki, Eden Energy Medicine, etc., and be doing that on a regular basis. Massage, acupressure, flower essences, all those different things. It's each animal needs different. But, definitely I have seen some where what made the difference for them was to get the radiation therapy.
Okay,
I wouldn't.
you wouldn't. All right. Yeah,
I would not do it personally with my cat.
it's extremely expensive. We're
And
looking
it's
at,
not very good for them, not very
We
much of a
don't
happy
even worry.
time for them.
Beyond the money, it's worse what it will do to her, to be in
Right.
there alone and scared.
Yep. It's not like a fractured bone. There's a fractured bone, I say go to the vet and get it fixed.
yep. All right. Well, thank you.
You're welcome.
Okay.
13-year-old with lymphoma, absolutely same thing, same answer, Nancy. Chemotherapy is one way to go. It often is more short term. The best approach is to be working with a homeopathic veterinarian, Dr. Charles Loops. People think his practice is closed. It is not. It is just that he's only doing cancer cases at this point. He's not doing a general population, general health care. But I would suggest, Nancy, that you go into the resource library, click on cancer. We have had so many webinars on cancer. I would dig in and really listen to the different opinions and the different options from all of the folks. Fresh food diet, leaning towards probably all meat, but not necessarily. Again, it depends on the animal. And going for quality of life is why I recommend going with the holistic, plus all the energy healing that I was talking about as well. Anything else specifically, Nancy?
No, but thank you very much for clarifying that for me. It's very difficult. I'm going to try to get a hold of Dr. Charles Lutz. Is that Lutz?
Oh, I'm sorry. Dr. Jeff will type it in. Charlie, I think it's DrChrlesLoop as in Peter S.com, like the loop in a rope. He's in Pittsburgh, North Carolina, and does remote. But any homeopath can also, they don't need to be specializing in cancer. But are you a member of Holistic Actions?
I'm joining.
Good, great.
I've been to several of these and I'm just, I don't know why I'm waiting. So once this is over, I'm joining.
Great. So
Yeah,
you want to go in and
yeah.
you want to watch all of the cancer webinars that we have, but more importantly is for everybody that has an animal that's ill, is to pay attention to our January, February, March speakers. During that time, especially January, where our speakers are talking about how your attitude can heal your pets or have them not do quite as well. And Anitra Frazier, who's talked at different times because of needing it to be more in daylight to be able to do her recording because she only uses a bicycle in New York City. She talks about how to talk to cats, and that applies to all ill animals, is you want to be thinking and speaking positively to them, and listen to the Bernie Siegel recording. You also, if you go to YouTube, there is Smart Pet Talk. And those, we have several Bernie Siegel videos there talking about just love your animals. So that's a really important chunk of it. And remember to take advantage once you become a member of scheduling your 15-minute call to help you both navigate, and also go to the video that says how to use the website. Take a moment to do that because there's so much on the website.
But you're all about love.
Yes.
Both of you, all of you, and love is so powerful. When your pet hears they don't even have to understand the words you're saying. They can tell from the tone of your voice, and it's so powerful. You know, you can be there hugging them, and it doesn't matter what's coming out of your mouth. They know how much you love them. They know you love them, but they know how much you love them. And love is the most powerful thing here on this planet, especially for our pets. You know,
for everything. That's what we
love,
need to all be doing all the time.
exactly.
Anytime a fear comes up, whether it's in terms of what's happening on the planet politically or environmentally or illnesses, as soon as that fear comes up, shift it to love. So you're absolutely right, Nancy.
Exactly. And you two are just so full of love. It's in your face.
Oh, thank you.
I'm watching you on the screen and it's just a part of you and you emanate it, and it's just beautiful. And I'm so glad I found you. Yeah.
Thank you, Nancy. Spread the word.
No, thank you.
Okay. Veronica can't speak, so she has a 7-year-old pit bull who's gotten some moles and skin tags. Do not cut them off. The only reason to ever cut anything off is if they're impeding movement and lowering quality of life. Because if these are spreading, what you want to be doing is everything I've been saying. Number one, let's see, maybe type in, Veronica, if you're a member of Holistic Actions. If member or not, you want to do the 101 Holistic Health course. And the key thing it talks about there is not to suppress symptoms. So that would be cutting off moles or skin tags. Moles and skin tags are an indication that the underlying energy field is out of balance. And how we get that back into balance is by feeding a great diet, decreasing toxins, eliminating as many as we can, doing all the love stuff we've talked about and energy healing preventatively before anything does get bad, and working with a holistic healer. Even if you're not a member, you can go to holisticactions.com/select, read the article about how to find a holistic veterinarian and how to work with them. Don't just go to the websites. Don't just search on Google. It's really important to be reading that article. It tells you everything you need to be able to find one. There are some great holistic vets in Albuquerque and Santa Fe, and a great one for horses up in the northwest of New Mexico, but there definitely ones are around. So don't focus on getting rid of the skin tags. Focus on rebalancing the energy field. So there's great behavior, energy, appetite, and mood. And there's not other little clues, what we call early warning signs of internal imbalance. And if there are, track them. And for those of you who are just becoming members, or maybe you've been a member and haven't done this yet, be sure you download the Healthy Dog or Healthy Cat Journal so that you're tracking the symptoms. And for instance, one of the early warning signs of illness for dogs is that they smell bad and need a bath, or their breath smells bad. Those are clues that we've sort of been mentioning, or that they're licking themselves all the time as if they're itching, but their skin isn't showing a problem yet. Or they have other repetitive behaviors. So those are clues, and there's dozens of them, that you need to be doing something different. It might be mental stimulation. Maybe a cat or a dog needs to be trained with games. At a thrift shop, I just picked up a book that's about 20 years old of 101 Tricks to Train Your Dog. And there's another one for cats as well. So when there are lots of causes of itching in dogs and cats, and what we call causes, like people would say, oh, my dog has fleas, and that's the cause of the itching. No, it's not. That is a trigger that triggers the dog to scratch. Now, there is a little tiny bit of a cause in there. The actual bite, when they bite, the dog or cat may do a quick at it because of the actual physical sensation of so that's sort of a causation. But to have chronic itching because there were fleas, or there was one flea, or there's, quote, yeast, or there's, quote, bacteria, those are not the cause of the skin and ear problems. The other thing every time you see your cat itching or dog, you want to be happy, because there's a great book, and what Don Hamilton talks about is the nature of illness and the nature of cure. And what we've discovered in homeopathy, that's chapter 2 and 3. And then he goes into details on different body systems. Even though he's giving you a few homeopathic remedies, the most important part of his book is understanding what's going on. And so what's happening is, the first thing that happens when an animal or a person starts becoming ill is you think something's wrong, but there's no symptoms. You may wake up in the morning and you're doing everything you normally do, and you just know, I'm off. Something's off, right? I'm sure you've all had that. Or people would bring their animals into the veterinary clinic and go, my dog or cat is sick. And I'd go, what's wrong? What are the symptoms? And they'd say, I don't know, I just know he's sick. So that's the energetic imbalance. At that point, that's where you can use your energy healing techniques, your love. Just improve everything at that point, because the vet's not going to be able to help you much at that point. The second, if that doesn't fix the energy imbalance, the next thing is functional. So that's like your cat, itching, licking, but no skin problems. You don't see anything. Or a cat that's going to the litter box frequently, but your analysis is completely normal. There's no straining, there's no pain. It's just a bit at the functional level. And that's a good thing, to just be at the functional level. You can treat that. You can use flower essences, essential oils, homeopathic medicines sort of acutely for that. And we have multiple courses at Holistic Actions that can teach you how to use homeopathy for acute problems, or to start for treating problems like a cat that just licks itself a lot. And then if that's not treated at the functional level, we move into inflammation. And that's where the skin now is red, hot, inflamed, oozing. That's where the cat now has inflammatory cells in the urine. If it's not fixed at that level, it moves into tissue pathology. So as animals heal, they may have to go back up through that. It'll take longer once they're in the tissue pathology stage. Thickened skin, a thickened bladder wall, stones in the bladder. So if you can understand that, you'll be able to be more patient when the symptoms have been there longer or there's more severe tissue damage. When you're at the level, also what we know is when animals become ill, the first thing that might happen are skin problems. So if you have a pretty healthy energy field and it's been pushed off balance by something, we don't even know what it is. Maybe it's the solar flares that are going on today. Where it's going to produce symptoms, if it's pretty healthy, is on the skin. Have you ever, dogs and cats just don't die of skin disease. Human dermatologists say they're the luckiest doctors in the world. Their patients never get better and they never die. Well, they eventually die. And so be happy when the ailment is on the skin. Now, you have to look in other areas, always look at the mental, emotional. So when you have a cat that just came off the street who's been licking a lot, you may have to work with an animal intuitive and find out what's going on. You may need to use some flower essences, either skin soothing, stress stopper from Jackson Galaxy, or from one of the other flower essence companies. And we have many of those webinars from flower essence people online as well. So hopefully that gives you more answers on that. You'll have to keep track. I think I missed one thing in there. And then somebody just had their hand up. Yes. Go ahead. You're muted.
Hi.
Yes.
Thank you for answering that question. I know there's a lot of information there. I can definitely work with the homeopathic doctor, but I may have missed it because I was driving. If there's anything topically that I can put on, I know you're saying there's.
I would not use too much topical with cats. Anything topical, the cat wants to lick it off.
Okay.
So I would use flower essences internally. I would take the 101 course and make sure you're feeding the best diet. I would include things that are good for the skin, like omegas, some of the skin supplements that we talk about. Make sure the gut is healthy, and also make sure the cat's being exposed to dirt, grass, things to roll in, because there's a microbiome on the skin as well. And that's, I'm drawing a blank on her name, of Adored Beast, Julie Lee did a talk on the microbiome of the skin. And for those of you who wash your dogs, number one, it shows they're not healthy, but number two, you're getting rid of their microbiome. And she has a whole procedure to replace the microbiome if you have to wash. So with cats, unless there's a specific lesion that needs treating just for general itching, I would tend to not put anything on topically. I'd work from the inside out because we're not trying to stop the itch. We're trying to rebalance the underlying energy field, remove any obstacles to health so that the cat's energy field is back in balance and no longer needs to itch. And it could be mental.
Maybe it'll take time because of the stress from being in new environments, getting rescued off the streets and being
it's been a couple of months though.
No, it's been 1 month, but it changed 3 homes now. It went to a foster and then another foster. And
I
now,
would be
now
doing,
permanent home.
as Nancy said, lots and lots of love. And make sure don't worry about the skin. Get that out of your mind so the cat's not picking up on that. And be sure you listen. If you're not a member, become one and listen to, in 2 weeks, our webinar is going to talk about, for everybody here on the call, is going to be talking about how who's on each end of the leash can heal the other and can maybe make them not as healthy. So she's talking about how dogs, horses, cats can actually suggest to her, the animal, the communicator, the intuitive, what would be good to heal the people. And so it just goes to show how you're thinking if you're worried about the skin, as opposed to, let's see what we can do to get you as healthy as possible. Can you see that difference?
Yes, thank you so much.
Go for flower essences. And Dr. Jeff did give a topical probiotic spray, but again, with cats, I'd be a little, pay attention, try it. But if it increases the licking,
okay, thank you so much.
Sure.
Thank you.
And for Melissa and everyone else, Melissa, be sure you take the free 101 course if you don't become a member, but become a member. FERCP is not one vaccine. It is a whole bunch all put together in one syringe. And the panleukopenia is the only one of it that can really kill cats. And the panleukopenia vaccine is, we're taught in immunology class, is the most effective vaccine for any species in the world and gives lifetime immunity. So you never need to repeat the panleukopenia. And the upper respiratory, that can all be treated holistically if they get it, and it's not usually lethal. And it just overstimulates the energy field. Think for yourself, Melissa, are you getting chicken pox, measles, and 10 other vaccines that you got as a kid every year of your life until you die? Now, unfortunately, in vet school, we just were mistaught. So it's good for you that you're educating yourself, each one of you here, and that you are learning for yourself. And you'll have a local vet you may have to work with, and it could just be the emergency room, because at the ER, they usually don't push vaccines. Because the local vets might not want to refer people to the ER if they're taking over their vaccines. So often that's much an easier place, maybe a little more expensive, or you have to wait. And that's why if you're a member of Holistic Actions, you can post in the forum and usually you hear back within 24 hours. And by studying all that we offer, you will feel much more comfortable about waiting and not rushing to the vet. Like Jenny, who's here today, she only goes to the vet for prevention, for checking things out or some preventative blood work, things like that. She waits. If her dog starts limping, she waits and watches, does some energy healing, checks that the food is good. If she knows there was a little sprain, then, she might do ice or homeopathic medicine. So you'll learn enough not to panic. We have holistic medical decision making, HMDM. So if you're new to Holistic Actions, you'll read about it for free in the 101 course, or you'll study more about it in the many webinars that we've had. Nadia says that skin issues could be about abandonment conflicts. Absolutely. And again, that's why this energy healing approach is so important. So I'm also very passionate about the environment more and more and more as I've become older, but always have been. And the decisions we make every day with our animals impacts the environment a lot. So you want to always be thinking, what can I do that doesn't take away from the environment? So that's another reason for learning energy healing techniques. Imagine two scenarios. One scenario is a cat who's being fed kibble. The kibble food has to be made in a factory. Ingredients are shipped in from around the world. Lots of stuff goes on in the factory that takes energy, packaging, then it's shipped to the distributor or wholesaler, and that is a lot of packaging. And then it gets shipped to the store. And then, because it's not very good diet, and particularly for kitties, it dehydrates them, kibble does. And so then they may develop a bladder problem. So then they go to the veterinarian, and the veterinarian does a bunch of tests. So all of that takes a little bit from the environment. And then they recommend drugs, which, again, there was a factory that made the drugs. It got packaged, shipped, distributed, as opposed to this other cat. This cat, they go to a local farm. Every 2 weeks, they go to the local farm or they go to the farmer's market. They're shopping for themselves and they add in a little bit for their kitty. Or if they have a Great Dane, they shop for an extra adult person. They buy a whole lot of meat and organ meat. And they're making the food at home. Not much cost to the environment. You're supporting a local farmer who's probably, if not organic, is calming and helping the planet, is nurturing the planet. And then because of some stress that's happening in the household or something else, this kitty develops some bladder problems, is going to the box frequently. But instead of going right to the veterinary clinic, this person has been trained in Eden energy medicine or several other energy modalities and just lays on their hands, sends energy, sends love. And all of a sudden the symptoms are gone and they're resolved. So the cost to the planet is better than zero. I mean, the cost is less than zero, because when you're giving energy healing to your animals or yourself, you're also giving it to the planet. And so therefore you've contributed positively to the planet. So that's just another shout out. And so then there are things that we love that still cost the planet not as much. So flower essences, they have to pick flowers, put them in water in the sunshine, is sort of the original way of making them, and then add some alcohol to it, but they have to bottle them and ship them. So there's still a little cost to the environment, but not a lot. And the other thing is, once you've ordered a bunch of flower essences, I still have ones that, when did I start this? 40 years ago? Some of my flower essences their rubber top didn't deteriorate and they're in great shape. And so they're good for a long time. Homeopathic medicines do have to be made and bottled, but you don't use much of them. And even though there's an expiration date on the bottle, they never expire. How about that? They're energy medicine. They never expire. I have talked to people in St. Louis that were part of the St. Louis Homeopathic Study Group. And St. Louis is where Dr. James Kent in early 1900 had a homeopathic medical practice, wrote one of the repertories, was a leading teacher in homeopathy for the doctors, and he made some of his own remedies. So they have his kit. That was made in 1900. People from the study group would be prescribed a remedy by their doctor, their homeopathic doctor, and they would go and request, they would say, could I take it from Dr. Kent's kit? And if there was plenty of pellets in the vial, they could. And they said not only did it work, but it seemed to work better than current remedies. And then I've talked to a homeopathic veterinarian in Germany who has seen the same thing being done with Samuel Hahnemann's remedies made in the late 1700s. So they don't expire. Sometimes they go bad because they get exposed to something, but not often. So those had a little bit of a cost. Acupuncture, little bit of a cost because of the needles. Acupressure, no cost. Tellington Tea Touch. They do use some wraps and wands and feathers, but you can usually make those from something natural. And so that's another approach. I was just at a Tellington Tea Touch 50th anniversary celebration course, and I could only go for a few hours. The miracles that they're doing with not just behavior, but actually even physical problems, like that kitty that you've just gotten, who's been from house to house, and you might be able to use a lot of the techniques of Tellington method to really get the cat back in her body so she doesn't feel the need to lick so much. And also, if you can pet her and brush her, brushing could help as another way that could help. And so Nadia suggested red chestnut, which is one of the Bach essences. So I'm not sure which method I talked about so many. So Tellington method is one I spoke about. Eden, EDEN, energy healing is another. And these are all the types of things that in my practice, I no longer treat animals with homeopathy, but I do pet health advising or pet health coaching to get you on the right track and matched up with a veterinarian. So it's sort of like teaching, which I love. It's just another version of teaching. And I'm not seeing any hands or any more questions. I can't believe this. So who else?
I guess.
Did I miss anything?
Wrap it up, but no, I think you got them all.
So I want to tell you some good news. I was at the North American Veterinary Conference, which has changed its name to something weird, but NAVC. So this is thousands of conventional veterinarians. It was huge. I was just there for a couple of days, but one night was the veterinary school gatherings. And so I went to the University of Georgia gathering, and at one point I sat at a table that had 3 veterinary students that were freshmen and one young man who was working at an emergency clinic but hadn't yet gotten into vet school. He didn't get in the first year and plans to keep applying. So I was thrilled about a couple of things. One, from the freshmen, what they were saying is being taught. Dr. Jeff and I had never even heard of the microbiome. Well, actually, Dr. Jeff probably did because he studied that. Didn't you study some microbiology, Dr. Jeff?
In vet school, I don't think
no, in graduate school. Graduate school.
Yeah.
But in veterinary school, they never, and other places, medical school, they didn't talk about the microbiome. They didn't talk about how the fascia is one piece. We sort of knew there was this tissue that was around each of the organs, and there was this tissue sort of connecting in the intestinal, abdominal area, but we didn't understand the depth of the fascia and the impact of the fascia and the microbiome. So there's the microbiome of every single organ in the body, not just the gut. And the fascia, sometimes behavior problems can be because the fascia is stuck somewhere. Or lameness might be a limping dog limping on the rear leg could have some fascia stuck up in the neck or even in the chest, causing it to be lame in the back. So it's just wonderful. It's good news that they are teaching more about the microbiome and more about the fascia, because that opens up the possibility for students to start seeing from more the whole, WHOLE perspective. So I'm going to take just a second here to see what Erica asked. So actually, just because I've just been there, Erica, there was a speaker at the Tellington celebration this weekend who talked specifically about feral animals and feral cats and had these amazing videos. So there was a feral cat who was always under things, wouldn't come out, wouldn't allow it to be touched at all. And they used feathers and wands that would reach in underneath wherever the cat was hiding and would just for just 2 strokes, would move the feather near the cat, maybe touch on the front or the back, and then pull away and just sit there sending love for 5 minutes and then come back in. And within 4 weeks, this kitty was cuddling.
Oh, that's awesome.
So the possibilities with Tellington method are phenomenal.
Okay.
Equally good to explore would be, certainly using food as a way, seeing if you can get the cat to come out just a little bit further when you're there with the food. Just put the food and sit and be patient. I would definitely get Anitra Fraser's book, The Natural Cat.
I have that.
Good. Read. Yeah. She has a whole section about introducing cats, and I think shelter
I need to get
cats.
back into it. I have it and haven't been in it for a while.
Good. Dig in.
He is a feral that I was feeding outside and needed help, so I trapped him, got him to the vet. It was a whole amazing traumatic thing. The vet was fine. My doctor is amazing. And then because I'm a genius, I lost him in the parking lot of the vet. He got away from me. It was horrible. We searched for him for 9 days, had the help of wonderful neighbors, and we trapped him again. We brought him home. He's currently has a bedroom to himself, and he, of course, chose the closet over the open bedroom. So he has kind of a little house inside the closet. There's a shelf where he can be under or he can be up. He's using a bed now. He's gotten into a cat bed. I feel like we're making tiny steps where he's hissing less.
Yep.
When I give him food.
The
My
key
hands
is just
get a
being
lot. Oh,
the
sorry, go
key
ahead.
is being patient, but you can also speed it along with working with an animal intuitive, doing flower essences.
That's one that I wanted to do. We've added flower essences. I have
Mhm.
a great vet here in Utah that's a holistic vet.
Who is that? Is it
Dr.
Tara?
Kimberly Henneman.
Yeah, Kim is great. We
Yeah,
know
so
we've
Kim,
actually had her as a speaker
awesome.
so if you're a member of Holistic Actions, you can listen to her talk. And then
Oh, look for that. That's cool. Okay. Yeah,
yep.
so she had me add flower essences. We have the FES flowers version of Bach Rescue Remedy. And I added a specific other flower essence to it for him to make him a special one. I feel like we're taking tiny, tiny steps. I also feel like my personal human emotions are that I'm holding him hostage in the closet, but that's all
Well,
me. That's my problem.
Yeah, and that's critical, like we've talked about a lot today.
Right. And
Your thinking
yeah,
is
because the door is
critical.
closed, I'm like, okay, stop it with all this before I go in. Like I
Good.
try to clear before I go in
Great.
the room and I talk happy and I'm like,
There
hi,
you go.
buddy, I'm coming to see you, even
Good.
though I know he doesn't want to see me. And I
Well,
love,
but you don't don't even make that assumption.
right. Yep.
He may very well want to see you,
Okay.
and his body isn't allowing him from past history to react in a way that shows you that he wants to see you.
Okay.
There's also for all of you, actually in my newsletter, either January or February newsletter, if you go to christinachambreau.com and sign up for my newsletter, I talk about, well, actually, we had a speaker. Oh, no, she's coming no, which one? When's the one who's talking about the calming signals? We had a speaker who talked about calming
We
signals.
just did last week.
That was last week,
Yeah.
was the calming signals. It's amazing how much we don't understand about our dog's language and our cat's language. You know, if a dog turns away from you, it's trying to calm you down, appease you, as opposed to saying, I don't want to be with you. I mean, it could be either one, but it
Right.
very often is they yawn. Yawning isn't because they're sleepy. Yawning is trying to appease you or calm you. So we need to learn more about, we need to learn to observe and not make assumptions.
Yeah.
But it sounds like you're moving in the right direction, and to have Kim working with you is great. So
yeah, I just thought since there was still a couple minutes, I would pop in, and I don't
that
want to
gives you a
rush
few
him.
more.
I want to honor what he wants, but if there's anything I can do to make it easier for him, I also want to do
Well, that's
that.
a few things, and you'll pick up a ton more.
Okay, thank you.
So keep checking on Holistic Actions, and you'll see we've got lots of webinars on that, and also comments in the forum.
Thank you.
And just one more thing I was going to comment on. If you remember, listen to Lisa Spector's webinar about music, because calming music would be really, really good for him at this point.
Yeah, my husband's so good. He puts up with all of my cattiness. We actually went and got a TV for him. And so there's a TV in the room. I have a really wonderful kitty rescuer friend who's helping me as well, and she's 50 years of experience of cat rescuing. So he has a TV, and he gets like cat TV during the day and then calming music at night.
Great, beautiful.
Wonderful. You're doing lots of good stuff. So
Thank you.
I wanted to also just, Rachel commented that Marlene, so as you save the chat, you'll see this, that Dr. Marlene Siegel, who has a veterinary practice down here in Florida, did a class on fascial manipulation. So, and most of her classes, she does turn into evergreen classes that you can do online. So it may be available. So you might want to check out her clinic as well. So we need to actually wrap it up. We're going to be doing a recording in a few minutes for one of our next speakers, actually the speaker for this Monday night. So be sure you tell everybody about this Q&A, and remember that for free, people can take the 101 course. For free, they can search the forum and read what people have posted. And for free, they can do the article on finding and selecting a holistic veterinarian. And hopefully, those of you who aren't signed up already will dash over and sign up. But I want to just take one moment, and this is our first one in this year. And I want to thank each one of you for being here. I want to thank each one of you for thinking outside the box and for actually being willing to do things that not everybody approves of. And so thank you. Thank you for being here. And thank you, Dr. Jeff, for creating this whole thing.
And thank you for taking the words out of my mouth. I was going to just thank everybody and thank them for just seeing things differently, acting different and being different and going beyond what we learned in vet school, because you all know more about healing animals than we actually learned about. But that's a different story. And Nancy, love is the key. Love is energy, and the mitochondria that provide the energy are the source of every disease in the body. And we're just all about balancing that love and that energy. So we'll see you guys next month, or on Monday.
Or on
Monday,
Monday.
right?
Absolutely, most of you. All
Thanks.
right.
All right. Bye-bye. Thank you.
Thank you so much.